So my name is Sabine van der Veer. I'm a professor of health informatics at the University of Manchester, and I'm one of the co-investigators on the Health Research from Home program. So what we're going to do this part of the afternoon is we have some announcements about the program, so some things that already happened last year, but also looking forward to the events that are upcoming in the next couple of months. But the main part of this part of the afternoon will be for the tech showcase, where we have 3 really exciting speakers who will share some of the new developments when it comes to using consumer devices to measure things about our health. So I'm going to hand over to my co-chair, who's now mic'd up, thank God.
Yes, finally. Thanks, everybody. My name is Michele Rini, King's College London, and it's my pleasure today to announce the winners of both the Hackathon and the Grant Writing Retrieval 2025, which were very exciting and successful programs. So for the Hackathon winners, it's my pleasure to announce that the winners were Rebecca Gordon, Lena Lai, Shokju, Jaji, and Ekgari Kasawala. And I would like them to come on stage, please. And thank you very much. And I believe you you have prepared
A presentation, right? So I'll hand
a presentation that
Do you need
we are
more than
very
one mic?
looking forward to.
Well, okay,
Fantastic.
yeah. I've got a clicker as well. There you go.
Excellent. So thank you. So we're going to give you, we are the winners of the 2025 Health Research from Home Hackathon, and we're going to give you a really, really quick overview of what we worked on and what we gained from the experience.
So task 1 involved including the data, the synthetic data generators for daily pain scores, and in people who have the rheumatoid arthritis over 6 months, using multi-state model, we capture realistic longitudinal patterns, including the treatment effects, flares, day-to-day variability, and with the disease severity represented as the distinct states, and clinician and patient input ensure the model to be to reflect the real-world experiences, and so we implemented as the shiny dashboard, and which can let users to adjust the parameters and visualize trajectories and compare patients, and then download some synthetic data sets.
So task 2 is about prediction, and the aim was to develop and validate an algorithm that could accurately predict future pain score for about 800 patients, and use as little costly as data as possible from a data set of about 180 days. And we approached this using a random forest model, and we split the data into training and test and validation, and we were able to balance between predictive accuracy and computational efficiency while keeping the data usage to a minimum.
So one of the main highlights of the experience was the clinicians as well as the patients. They gave us a lot of perspective in the background of their lived-in experiences, and also just clinical reality from the beginning. So the facilitators also really helped in keeping the discussions focused, inclusive, and also supportive. So made sure that everybody was able to contribute. Another thing was the tasks were very clearly structured with well-defined goals, so it was very easy to get started and progress. And also the diversity of the group from different interdisciplinary fields was also a huge asset in helping us get to our outcome. Thanks. Thank you.
So it was a really great opportunity, and we would recommend if any other early career researchers want to go along next year. We found that it was really great to build a network, to learn new skills, and to actually apply your skills to kind of an interesting problem. And as Ekgari was saying, really get feedback from patients and clinicians about how we can use data science in these tasks. So yeah, it was great. Thank you.
Thank you very much. and great to hear your feedback about the Hackathon event and more about the Hackathon in a few minutes. And now is the time to say goodbye to the winners of the Hackathon. Thank you very much. And it's my pleasure to announce the winners of the grant writing retreat. And I apologize for any mispronunciation. As someone which has very easy to mispronounce name, I definitely understand and feel the pain, but I'm gonna try. So please welcome Matthew Thompson, Aminu Umar, Chelsea Sawyer, and Sampurna Kundu. Thank you.
Hello, good afternoon, everyone. My name is Dr. Aminu Umar. I am a GP and academic clinical lecturer at Keele University in Newcastle-under-Lyme. And myself, along with my colleagues, were at the grant writing retreat last summer at Manchester. Myself, Matt, Chelsea, and Sam were the winners of the grant bids. It was an exciting 2 days, full days of learning, which was structured to include keynote presentations, expert advice clinics, interactive sessions on PPIE, information governance, and technology. So for the first day, each and every one of us presented their individual pitches, and subsequently we were split into groups within which we agreed on a research idea to work on over the 2 days period. And following the sessions, we kept developing the idea. And at the end of the grant writing retreat, each group presented before a panel of judges, and we were scored. Unfortunately, we came out being successful as the winners. So I would invite Matt, my colleague, to talk through the details of our idea.
Yeah, thank you. So we're the only two representing from the team doing the presentation today. But yeah, the project idea was one which I brought to the grant writing retreat, which was very briefly looking at using wearables for the earlier detection of relapse episodes in bipolar disorder. So this is some work which has continued to develop following the grant writing retreat, and hopefully will form the basis of a PhD fellowship application for myself in a couple of years' time. But I was a little bit uncertain before whether it would be okay to bring this to the grant writing retreat, because it was quite an early stage idea, it wasn't fully formed. But actually it was a really useful opportunity to think about it some more over the 2 days and develop it a little bit further. And lots of the practical advice from the technology clinics and the PPIE sessions was reflected in the revised pitch that we gave at the end of the grant writing retreat. So if anybody is considering it, I would say don't worry about having a perfectly formed idea that's imminently ready to be submitted for a grant. I would say it's a really useful opportunity, and there was plenty of wise advice in general about grant writing. So I think that is more or less everything that we had to say. Thank you very much for listening.